Hello, everyone. Welcome back to English After Hours. I'm Tim.
And I'm Stef. Tim, I just got off a video call with my sister, and she was telling me the most incredible story about her daughter's school nurse. Apparently, little Emma scraped her knee during recess yesterday, and instead of just putting on a bandage, the nurse spent 10 minutes teaching Emma and her friends about proper wound care and why cleaning injuries is important.
What a fantastic nurse. Turning a simple first aid situation into an educational moment. That's brilliant teaching.
Right? My sister was amazed because Emma came home excited to share everything she learned about germs, antiseptic, and how our bodies heal themselves. She even drew pictures of white blood cells fighting bacteria.
That's adorable and educational. It reminds me of something that happened in my classroom last week. One of my students mentioned feeling nervous about a dentist appointment, which led to this amazing discussion about dental care in different countries.
Oh, that sounds fascinating. What did you discover?
It turns out that dental care practices and attitudes toward preventative medicine vary significantly around the world. Some of my students come from places where regular checkups aren't common, while others have very different approaches to oral health.
It's interesting how healthcare can be so culturally influenced. Did the conversation help the nervous student feel better about the dentist visit?
Actually, yes. Other students shared their own experiences and tips for staying calm during medical appointments. By the end, the whole class was sharing health advice and comparing healthcare systems from their countries.
I love how health topics can bring people together through shared experiences. Everyone has stories about doctors, hospitals, or staying healthy, regardless of where they're from.
Exactly. And as we were talking, I realized how complex medical and health vocabulary can be for English learners. There's so much specialized terminology, but it's absolutely essential for daily life.
Especially for people living in English-speaking countries who need to communicate with healthcare providers, understand medical instructions, or even just discuss basic health concerns with friends and family.
Plus, health topics appear frequently in IELTS exams. Questions about healthcare systems, staying healthy, or describing medical experiences are quite common.
You know what? I think our health-related conversations this week perfectly illustrate why this vocabulary is so important and practical.
I couldn't agree more. These real-life situations show exactly why today's lesson is so valuable.
Absolutely. Today we're exploring health and medicine vocabulary that's both essential for daily life and crucial for academic English success.
Before we dive into medical vocabulary, please remember to subscribe to English After Hours, hit that notification bell, and give us a thumbs up.
And remember, we upload new lessons every single day. Make sure you don't miss tomorrow's episode.
Today, we're covering essential vocabulary for discussing health conditions, medical appointments, healthcare systems, and wellness practices.
This topic is particularly valuable for IELTS students because health questions appear regularly in speaking tests, and medical vocabulary is useful for writing tasks about lifestyle, social issues, and personal experiences.
Are you ready to learn health and medicine English?
Let's get started. Today we're learning how to talk about common health problems and symptoms, describe medical appointments and treatments, discuss healthcare systems and medical professionals, and express opinions about wellness and preventative medicine.
That's right. Whether you're communicating with doctors and nurses, discussing health concerns with friends, describing medical experiences, or preparing for IELTS speaking questions about health and lifestyle, this vocabulary is essential for effective communication.
You'll use this vocabulary when making medical appointments, describing symptoms to healthcare providers, discussing health insurance, explaining medical history, and talking about fitness and wellness practices.
We'll learn vocabulary for different medical conditions and symptoms, healthcare professionals and medical facilities, treatments and medications, and how to express concerns and ask questions about health topics.
Since I've had experience navigating healthcare systems in different countries through my travels, while Tim has experience with student health services and routine medical care, we can explore various aspects of health and medical communication.
Let's start by talking about common health problems and how to describe symptoms clearly.
Tim, thinking about your classroom discussion, what are some basic health problems that people commonly experience and need to talk about?
Well, everyone deals with minor illnesses like colds, headaches, stomach aches, and fatigue from time to time. These are universal experiences that provide good opportunities for practicing health vocabulary.
How would you describe these common symptoms to someone learning English?
A cold usually includes symptoms like a runny nose, sore throat, coughing, and sometimes fever. You might say, I have a stuffy nose, or my throat feels scratchy. Headaches can be described as my head hurts, or I have a pounding headache, or I feel pressure in my temples. Stomach problems might be my stomach is upset, or I feel nauseous.
Those are really practical examples. What about more serious symptoms that require medical attention? More serious symptoms include persistent pain, high fever, difficulty breathing, severe headaches, or injuries like cuts that might need stitches. It's important to know how to communicate urgency when necessary.
Can you give examples of how to express different levels of medical urgency?
For minor problems, you might say, I don't feel well, or I'm a bit under the weather. For moderate concerns, you might say, I'm worried about this pain, or I think I should see a doctor. For urgent situations, you might say, I need to see a doctor immediately, or this is an emergency, or I need to go to the hospital right away.
Learning to communicate urgency levels is so important for getting appropriate medical care. Now, let's learn essential vocabulary for symptoms and common health conditions.
Common symptoms: headache, fever, cough, sore throat, runny nose, nausea, dizziness, fatigue, pain, swelling.
Describing pain: sharp pain, dull ache, throbbing, burning sensation, stabbing pain, constant discomfort, comes and goes, getting worse.
Common conditions: cold, flu, allergies, infection, sprain, bruise, cut, burn, rash, food poisoning.
Let's practice describing health problems and symptoms. This vocabulary is essential for IELTS speaking tasks.
How would you describe a time when you felt sick and needed to explain your symptoms to someone?
Last winter, I came down with the flu and had to call in sick to work. I told my principal that I had a high fever, body aches, and severe fatigue. I explained that I felt too weak to teach effectively and didn't want to risk spreading the illness to students.
How did you communicate the severity of your symptoms?
I was specific about the symptoms and duration. I said I had a fever over 101 degrees for 2 days, my whole body ached, and I could barely get out of bed. This helped my principal understand that it wasn't just a minor cold. I also mentioned that I'd already taken over-the-counter medication but wasn't feeling better, which indicated that rest was necessary for recovery.
That's excellent communication. Being specific about symptoms and duration helps others understand the situation. Can you describe a time when you had to seek medical care? A few years ago, I developed severe stomach pain while traveling in Mexico. I had to explain my symptoms to a doctor who spoke limited English, which was challenging but educational.
How did you communicate across the language barrier?
I used simple, clear language and pointed to where it hurt. I said things like, pain here, started yesterday, very sharp, and getting worse. I also used my phone to translate key words like nausea and medication. The experience taught me how important basic medical vocabulary is for international travel and communication in emergency situations.
That must have been stressful, but it's a great example of practical medical communication under pressure. Now, let's learn vocabulary for medical professionals and healthcare facilities.
Medical professionals: doctor, physician, nurse, dentist, pharmacist, therapist, specialist, surgeon, pediatrician, psychiatrist.
Healthcare facilities: hospital, clinic, doctor's office, emergency room, pharmacy, dental office, urgent care, health center.
Medical departments: cardiology, dermatology, orthopedics, pediatrics, radiology, laboratory, intensive care, maternity ward.
Let's practice discussing medical appointments and healthcare interactions. This vocabulary is useful for IELTS speaking about services and experiences.
Can you describe the process of making a medical appointment and what happens during a typical doctor visit?
When I need to see my doctor, I first call the medical office to schedule an appointment. The receptionist asks about the reason for the visit, my availability, and insurance information.
What happens when you arrive at the appointment?
I check in at the front desk, provide my insurance card and ID, and fill out any updated forms about medical history or current medications. Then I wait in the waiting room until a nurse calls my name. The nurse typically takes my vital signs, blood pressure, temperature, weight, and asks about my symptoms or the reason for the visit. Then the doctor examines me, asks questions, and discusses treatment options.
How do you prepare for medical appointments to communicate effectively? I always write down my symptoms and questions beforehand, so I don't forget important details during the appointment. I bring a list of current medications and mention any allergies or previous medical problems.
Do you have strategies for understanding medical explanations and instructions?
I ask the doctor to explain things in simple terms if I don't understand medical terminology. I also ask for written instructions for medications or follow up care, and I repeat back important information to confirm I understood correctly.
Taking notes during appointments can also help you remember instructions and recommendations later. Now, let's learn vocabulary for treatments, medications, and medical procedures.
Treatments: medication, prescription, antibiotics, pain relievers, physical therapy, surgery, rest, exercise, diet changes.
Medical procedures: blood test, x-ray, MRI, ultrasound, vaccination, injection, examination, checkup, biopsy.
Medication instructions: take twice daily, with food, on empty stomach, complete the course, side effects, dosage, refill.
Let's practice discussing medical treatments and following medical instructions. This is practical vocabulary for anyone living in an English-speaking country.
Have you ever had to follow complex medical instructions? And how do you ensure you understand them correctly?
When I sprained my ankle playing basketball, the doctor gave me detailed instructions about ice therapy, elevation, pain medication, and gradually returning to activity.
How did you make sure you followed the treatment plan correctly?
I asked the doctor to write down the schedule: ice for 20 minutes every 2 hours, elevate the ankle when sitting, take ibuprofen as needed for pain, and avoid running for 2 weeks. I also asked about warning signs that would require calling the doctor, like increased swelling or severe pain that didn't improve with medication.
That's thorough preparation. Have you had experience with prescription medications and pharmacy interactions? Yes, when I had a bacterial infection, I had to get antibiotics from the pharmacy. The pharmacist explained that I needed to take the full course even if I felt better and warned me about potential side effects.
What did you learn about communicating with pharmacists?
Pharmacists are excellent resources for medication questions. They explained drug interactions, told me to take the antibiotics with food to avoid stomach upset, and gave me their phone number for questions.
I also learned to always check that the prescription label matches what the doctor prescribed, and to ask about generic versus brand name options.
Pharmacists can provide valuable information that helps you use medications safely and effectively.
Now let's learn vocabulary for healthcare systems and health insurance.
Healthcare system: health insurance, co-payment, deductible, coverage, provider, network, premium, claim, benefits.
Insurance types: employer insurance, government insurance, private insurance, international insurance, student health insurance, travel insurance.
Healthcare access: in-network, out-of-network, referral, pre-authorization, emergency coverage, preventative care, specialist visit.
Let's practice discussing healthcare systems and insurance. This is particularly important for people living or studying in English-speaking countries.
Can you explain how health insurance works in your experience, using simple terms for someone unfamiliar with the system?
Health insurance helps pay for medical expenses, but it can be complicated. You typically pay a monthly premium to maintain coverage, plus additional costs when you receive medical care.
What are some key terms that people need to understand?
A copayment or copay is a fixed amount you pay for certain services, like $20 for a doctor visit. A deductible is the amount you pay out of pocket before insurance begins covering costs. In-network providers have agreements with your insurance company for lower costs, while out-of-network providers may cost more or not be covered at all.
How do people navigate insurance when they need medical care? It's important to understand your coverage before you need medical care. I always check whether my doctor is in-network, what services require referrals from primary care physicians, and what my copays are for different types of appointments.
Do you have advice for international students or travelers regarding health insurance?
International students should definitely get student health insurance through their school or purchase international health insurance. Travel insurance is also essential for short trips, especially to countries with expensive healthcare systems.
Understanding your insurance coverage can prevent expensive medical bills and ensure you get appropriate care when needed. Now let's learn vocabulary for wellness, prevention, and healthy lifestyle choices.
Preventative care, regular checkups, vaccinations, screenings, dental cleanings, eye exams, annual physical, health monitoring.
Healthy lifestyle, balanced diet, regular exercise, adequate sleep, stress management, avoiding smoking, limiting alcohol, staying hydrated.
Wellness activities, meditation, yoga, walking, healthy eating, vitamin supplements, mental health care, work-life balance.
Let's practice discussing wellness and preventive healthcare. These topics are common in IELTS speaking tasks about lifestyle and health.
What preventative health measures do you think are most important for maintaining good health?
I believe regular exercise and healthy eating are fundamental for preventing many health problems. Even simple activities like walking 30 minutes daily and eating plenty of fruits and vegetables can make a significant difference.
How do you maintain healthy habits in your daily routine?
I try to build healthy choices into my regular schedule rather than treating them as special activities. For example, I walk to work when possible, pack healthy lunches, and go to bed at a consistent time. I also schedule annual checkups and dental cleanings just like any other important appointment, rather than waiting until problems develop.
What role does stress management play in maintaining good health?
Stress management is crucial because chronic stress can contribute to many physical and mental health problems. I use techniques like regular exercise, adequate sleep, and setting boundaries between work and personal time.
Do you think preventative care is equally accessible to everyone?
Unfortunately, not everyone has equal access to preventive health care due to factors like cost, insurance coverage, geographic location, and work schedules that don't allow for time for medical appointments. This highlights the importance of making healthcare more accessible and educating people about preventative measures they can take independently. Now let's learn how to express concerns and ask questions about health topics.
Expressing concern. I am worried about. I'm concerned that. This doesn't seem normal. Should I be worried about? I think something's wrong. Asking for advice. What should I do if? Do you think I should? Is it normal to? How long should I wait? When should I see a doctor? Seeking clarification. Can you explain that again? What does that mean? How serious is this? What are my options? What happens next?
Let's practice expressing health concerns and asking medical questions. This communication is essential for effective healthcare interactions.
How would you express concern about a health symptom to a doctor or a healthcare provider?
I would be specific and honest about my concerns. For example, I'm worried about this chest pain because it's different from anything I've experienced before. Or I'm concerned that this headache has lasted for 3 days.
What questions would you ask to understand a medical condition or treatment better?
I would ask questions like, how serious is this condition? What caused this problem? What are my options? And how long will recovery take? I'd also ask about lifestyle changes. Is there anything I should avoid? What activities are safe? And how can I prevent this from happening again?
How do you ensure you understand medical instructions completely? I ask for clarification when needed. Could you repeat that? Or can you explain that in simpler terms? I also confirm my understanding by saying something like, so you're saying I should take this medication twice daily with meals?
It's also important to ask about potential problems, like what side effects should I watch for? Or when should I call if I'm not feeling better?
Being an active participant in healthcare conversations helps you ensure you receive the best possible care.
Let's review everything we learned today. We covered common health symptoms and conditions, medical professionals and healthcare facilities, treatments and medications, healthcare systems, and wellness practices.
We learned essential vocabulary for describing health problems, communicating with healthcare providers, understanding medical instructions, navigating insurance systems, and discussing preventative health measures.
Remember, health vocabulary is incredibly important for IELTS speaking and writing tasks about lifestyle, social issues, and personal experiences. Plus, it's essential for daily life in English-speaking countries.
This vocabulary connects with our previous lessons too. Health affects daily routines, food choices, exercise habits, travel planning, and work productivity.
Practice tip? This week, try to describe your health routine or a medical experience using today's vocabulary. Focus on being specific about symptoms, treatments, and health practices.
For IELTS preparation, practice answering common health questions like, how do people stay healthy in your country? Or describe a time you were sick or injured.
You can also practice expressing concerns and asking questions about health topics using the communication strategies we learned today.
Before we finish today, we have your homework assignment.
Tell us about your health experiences or wellness practices in the comments. Use the vocabulary we learned today.
For example, you could write, I maintain good health through regular exercise, balanced nutrition, and annual checkups. When I'm sick, I rest, drink plenty of fluids, and see a doctor if symptoms persist.
Or, last year I sprained my wrist and learned about physical therapy. The therapist taught me exercises to strengthen my wrist and prevent future injuries.
Challenge. This week, practice describing health symptoms or asking health-related questions using today's medical vocabulary.
Tomorrow, we'll explore technology and digital life in greater detail, advanced vocabulary for discussing modern technology, digital communication, and how technology affects our daily lives.
Thank you so much for learning with us today. Please subscribe to English After Hours, like this video, and share it with your friends who are learning English.
Remember, we upload new lessons every day, so make sure you're subscribed with notifications on so you don't miss tomorrow's episode.
Keep practicing, stay healthy, and we'll see you tomorrow for another essential English lesson.
Goodbye from English After Hours.
Bye, everyone!